Angelina with SurgiCare Arts and IBI Healthcare Institute, and I wanted to talk about the thing that's been used, which is CoolSculpting machine. What happens, what was the issue that they were talking about on some of the news channels yesterday, and really it's not the first time. CoolSculpting machine, as you all know, is a machine that's supposed to freeze the fat. Special machine where the attachments, they kind of look like little hollowed out things that suck the fat and skin into them, and then you lay there for about half an hour while it freezes the fat. When you finish with the procedure, you take off that little device, and then it looks like you have a little stick of butter underneath where the machine was working, and so that fat is basically frozen solid, and then over time you massage it out and it flattens out, and it's supposed to eventually kill those fat cells to make them go away. However, in some people, they have the paradoxical opposite effect. Instead of fat melting, fat goes, whoa, you're trying to injure me, I'm just gonna grow some more. They started growing the specific area where CoolSculpting was performed. It can be quite uneven. For example, I've seen patients who had both flanks done, and then one flank, the fat melted, the other flank, the fat grew. Now, you look quite lopsided, so that's not a pretty look. On the news, we have one of those supermodels from the past that I think she was trying to get back into, her career, and she happened to use that treatment, which is of course fine. I'm always promoting using minimally invasive methods to perfect certain areas or adjust certain areas that we don't like. She did it, and she had this paradoxical effect where fat grew instead of melting. I always advise patients to really talk to the provider, talk to the doctor. I don't have that machine myself. I've worked with it in the past. The reason I don't, because I've had quite a few patients come in for repairing of the problem, because now we have to go surgically to do liposuction or something similar to try to get rid of this overgrown fat where it used to be relatively flat area. I offer different services for my patients. I believe in heating the fat up where it melts away. It's much more smoother, more uniform results. We haven't had any issues with fat hypergrowing, so overgrowing on that, because the mechanism is different. If you have any questions about the treatments that we do use or how we can fix in case you were one of those unfortunate people where CoolSculpting actually caused the problem, we offer several ways of fixing it, both surgical with liposuction, using Vaser, using skin tightening, and also procedures like Evolve, which is radiofrequency based procedures, or Physiq, also radiofrequency based procedures to try to melt the fat with heat, gives more uniform result, tighten the skin using same kind of radiofrequency procedures, and of course we have surgical ways too. If you have any questions, I hope you're not the one of people who had the unfortunate results. If you do, we can help. For those who are considering it, do look at other options. If you have any questions, let me know. SurgiCareArts.com is my website, listing on Instagram and Facebook, SurgiCare Arts and Real Dr. Runway. Thank you.